everybody. You are listening to ToRAISE Questions Doula podcast. This is Melanie Headley. I'm sitting with Thérèse Hakoun. She's the executive director of toLabor, which is an international doula training and certification organization. Whew. I could say that in my sleep now.
Yeah.
Hi, Thérèse. How are
Hey,
you?
Melanie. How are you doing?
I'm good. It's good to see you.
Yeah, you too. I know you were at the beach, and you look like you were at the beach.
I was at the beach.
And I just have to say, I said to Melanie when I first saw her this morning, like, how was your trip to the beach? And she was kind of hesitating with her feedback. And I said, well, you looked like you had a really good time through the photos I saw. And she goes, yeah, isn't it funny how social media can portray you in a certain way? And it is.
Facebook said I had a great time at the beach. I didn't put all the pictures of my kids, crawling all over me and whining and fighting and yeah, but whatever.
But it was good to be at the ocean.
It was really good to be at the ocean. Yeah, it was beautiful.
I'm glad.
So,
today,
what will we be talking about?
We have a guest who you're going to introduce, and we're going to talk about postpartum depression, postpartum mood disorders. And I think it's going to be a great, great topic.
Yes, I'm so excited to introduce Joy Outland Brock. She is a toLabor trained doula, first of all.
Right.
And is also a licensed clinical social worker. So, I'm really looking forward to hearing what she has to say, because I know a lot of times, just as a doula, the postpartum phase is just as important to support a woman through as labor and birth.
Absolutely. This is why we invited Joy to come speak, because as I always talk about in workshops, it's one of the things that I really would like our workshop to be 4 days, not 3, which I would love to hear from listeners about that, because I've always felt that way for 20 years, that I want the 4th day so we can just really focus in on the postpartum period, because it's so important. So my just quick thing is, if you think a 4-day workshop is a doable thing, because what I find, please let us know, because what I found is that at the end of workshops, people are like, oh, and our constant feedback is, I wish it were longer. I wish it were longer. Mm-hmm. And I ask, would you stay for a 4th day? And everybody says yes. And I say, but would you have signed up for 4 days? And everybody's like, ah. So that's the hesitancy. But the importance of this topic is we do so much focus on pregnancy, labor, and birth, which is so important because that's what leads us to becoming a parent. But then to drop it and not address what happens next is just remiss of all of us for not dealing with it.
How many times have you heard your client say, well, but no one told me.
Nobody told me. And we hear that about, so that's why we cover it. We hear that in about their pregnancies and births.
Well, and it's like, no, I did tell you, but
you couldn't hear
take it in.
Yeah, you couldn't
because
hear
you weren't in it yet.
That's right.
Yeah.
So I think this is going to be a great topic. And before we move forward, I just want to put out there again that we are also sponsored by Latch Mama.
Yay.
Yes. And, the more I read about this company and the more I get to know Melissa, the founder of Latch Mama, the more I feel really grateful and proud to have them sponsor our podcast with us, because they are such a great organization.
They really are.
They're a business, but I think of them as an organization that is trying to not just make comfortable, accessible clothing for breastfeeding people, but they are also in a dialogue about the postpartum period, about breastfeeding.
Well, I love it because Melissa's in that phase herself.
That's right.
She's got living it and walking
little Caroline.
Yeah.
And her 2 other little boys. And she's in the throes of it all. Yeah. So please remember to check out latchmama.com and their Facebook page, and they have lots going on, and it's very interactive, and their clothing is, as Melanie and I have already discussed, extremely comfortable, and they're coming out with new styles all the time. They have a new dress out right now.
That's really cute.
Really cute.
And they have plus sizes, which is always great.
Right. So please remember to support Latch Mama.
All right, everyone, stay tuned. Okay, so everybody, I'm so happy that we have Joy Outland Brock here. She is actually in our studio.
Yeah, which is really nice.
Hi, yes. Joy.
Good morning, ladies. It's so great to be here. I've been listening to the podcast from day one.
Oh, that's wonderful. Thanks. So you know what you hear is now what you're going to be speaking about, which is great.
This is true. Actually, it is my ritual. When we talk about ritual around birth, the 3 R's, my relaxation and my ritual and rhythm is every time I go to a birth, I turn on the podcast, even if it's one I've already heard. Because I like to hear your voice, Therese.
Oh, well, thanks. This voice.
I love that so much.
I know. That is really sweet. I'm sorry if I'm laughing. It's just that I meet people also and they'll go, oh, I know your voice. It's so wonderful to meet you. And I just think it's so funny because I've always not liked my voice like so many other people, you know.
Well, I associate your voice not just with being in the training, but with the values around the training of just the human dignity of people and respect for women in the birth process. So it's kind of like my thing that I put on as I head in.
Oh, that's lovely. Thank you. So tell us a little bit about yourself before we start talking about this topic, like how you came to being in the doula world.
Okay.
And where you're at as far as a licensed clinical social worker.
Okay. So I knew nothing about birth except, well, I will say I was with my sister when she gave birth. I was 16 years old. Our mother had just passed away that summer.
I'm so sorry.
Yeah, thanks. So it was just really important for me to be there with her, obviously. She was only like 23. She was a single parent. So it was a very medicalized, managed birth, but there was me and like one other friend there to support her. So I kind of saw that part, but that led me to think that episiotomies were just what you did.
Right.
And, you know, that just this medical model was always what happened. Flash forward years later, I'm in graduate school to become a social worker. And as it often happens, there was a friend who was pursuing a VBAC and just started talking to me about natural birth. And it got me interested in more like the social justice aspect of it, not being a mother myself. And I just started researching and reading and talking to my husband so much that for Christmas that year,
I remember this.
He decided to buy me the doula training through toLabor as a gift.
I remember that. It's so funny, Joy, because I remember being contacted by him that he wanted to give his wife this present for Christmas. And I just thought it was the first time somebody had done that, that I was aware of. And I thought, what an awesome gift. And he wrote,
that is so sweet.
I know, he wrote about it, not just like, here, I want to buy this gift. He went into detail as to why he felt it was important for you to have this opportunity.
Yeah.
That's so wonderful.
He's good stuff.
Yes.
So he sent me to the training. It was a transformational, is that a word? Transformative,
yes.
Right?
Transformative, yes.
Weekend. And I didn't immediately start attending births. I was still kind of in the throes of graduate school. And then I graduated and was sort of trying to get my bearings doing clinical social work, which can be a little intense.
Yeah.
And so it wasn't until probably after I had my first child that I really started pursuing, about a year later, doing the birth doula work. And then as I started working with these families, seeing them throughout their pregnancy and then the birth and then the postpartum, it just made me get more and more passionate about supporting women. And just the whole family through that whole, we talk about the childbearing year.
Right.
And so at the time I wasn't, like, all my jobs were mostly in like nonprofits or community mental health, and I wasn't able to focus exclusively on postpartum women. But I think that was the journey that needed to happen, because in the meantime, I got a lot of training in trauma, expressive arts therapies,
Isn't
all
that
these
interesting?
things that now
Yeah.
really folds into my treatment when I'm working with women. And we're going to talk about, when I say women, I'm not just talking postpartum, because now we look at it as perinatal mood and anxiety disorders.
Right.
And so for listeners that may not know, perinatal refers to both the pregnancy and then the year following childbirth.
And I'm really glad you're pointing that out, because when I did the introduction, I talked about postpartum mood disorder.
That's
so
what
I'm
we all
really,
do.
I'm so very important to choose our words and make it more accurate to what the whole picture really is.
Yeah.
So thank you.
So, I mean, it's estimated that during the pregnancy, at least 1 in 5 women are going to experience significant depressive or anxiety symptoms.
During the pregnancy.
Mm-hmm.
Isn't that amazing?
Yeah.
And that number blows me away, but if I pause for a moment, it makes total sense to me, because I've spoken to so many people through these 30 years that exactly have, my numbers even might be higher than that, for the amount of people that I've encountered who are suffering from from a depression or some kind of anxiety issue going on.
Yeah. So, I mean, it's everywhere, and it's being vastly undertreated and under-recognized. And I think, we talk about how the state of maternal health care can be in crisis in America, but I think especially the maternal mental health care is really in crisis. We have a lot of moms not getting help, which leads to family suffering, it leads to baby suffering, and
Well, and so right now you are practicing as a doula, or some little not?
A little bit. I tend to take a lot of time off when I have babies.
Because you just recently had a baby.
Yeah. I had one, 9 months, but it still feels recent.
Yes.
Yeah. Yes. So I tend to take a lot of time off. I don't know where. I think it'll always be something I do somewhat, but I'm not like a Melanie where it's like almost like my living, because I think my skills lie in using my talents, whatever, to support women in a therapeutic environment.
And I think that's excellent. I think that's something also that listeners have to hear, regardless of whomever you are that are listening, that sometimes this work doesn't mean attending births.
Yeah.
It means finding your place, your strengths that you can apply. Because I always say that at a workshop, you will always do birth work for the rest of your life. Mm-hmm. It may not be attending births. It will come in other ways. And it can come in being a teacher. Mm-hmm. It can become in being the mother. It can be a counselor. It can be so many other aspects than just attending birth. So that's very valid to me, what you're saying.
I think as birth workers, the birth doula work is kind of like the sexy work.
Right
now.
Yeah, except we know that it's not very sexy either.
Yes, we know it's covered in all sorts of fluids and whatnot.
Yes.
But really what we need in this country is a whole framework of support.
You bet.
For the family.
Absolutely.
Beyond just the birth and the immediate postpartum.
So as a social worker, a clinical licensed social worker, you now see patients.
Yes.
And so tell us a little bit about your practice.
So I started into private practice during the last, 6 months. I guess back in January. Nothing like having a baby to help reframe your priorities and what you want to be doing with your life. So there I landed, and I just slowly have been trying to get word out that I'm interested in doing this work. I've been reading lots and lots and lots about what it means to support women during the perinatal period. And just this past month, I flew out to California and went to Postpartum International's conference and training on perinatal mood and anxiety disorders. So, yes, always be learning, ladies. Always be learning.
You bet.
And so now I'm slowly getting referrals to see women, and it's been wonderful. They're coming from all across the spectrum. What would you like to know about that?
Yeah.
Well, so do you have an office that you see women in, or do you go to their homes? And what primarily, are you seeing more pregnant women? Are you seeing more women in the postpartum phase? And where in the postpartum phase are you really getting these referrals from?
Okay. So I have an office. I'm not seeing women outside of the home right now. I will say the man that runs the company, like the office that I work in, he has been talking with lawyers around online therapy, which I have different feelings about, but I also realize that for women that are struggling to get out of their home in the postpartum period, that could have positive benefits. There is research to having just phone conversations for women in the postpartum period, that helping alleviate depressive symptoms. But for the most part, I prefer to have them in front of me.
Right.
There's just nothing quite like that. And you just need to have eyes on someone eventually.
I think so. Yeah, and everybody knows how I feel about the human connection, so I won't go there.
Yeah.
But I do understand, though, the benefit of what you just said, that it could be beneficial to people who really are just stuck inside their home. They can't get out, and better to have that as a resource than no resource at all. I just would hate to see that be the tide.
Yeah.
Where it all landed. Yeah. Because again, people already know how I feel about everything online. Yeah. Losing that connection.
Yes. No, I would agree. And I'm still just kind of in the infancy of starting to do this work on a professional, doula related aspect. Right. So I'm finding that some people are getting referred to me while they're still pregnant and they've had some depression or some anxiety symptoms, and usually their doula, thank you doulas, are encouraging them to seek help.
Right. Isn't it interesting? Because we want it, it just goes to how important having a doula really is. And if not a doula, which we think everybody should have a doula regardless, but a healthcare provider who really understands this topic, because all the people who don't have doulas, are they being referred by their obstetrician, which is the most common primary care provider that people have in this country for their maternal care. And so, this is why this topic is so important.
And I work a very small part-time job within a hospital setting, and I just gave one of the obstetricians a list of LCSWs in town who do really focus on postpartum counseling, because they didn't have that information. Right. And so it was so nice for me to say, I just overheard a conversation, and I said, wait, I have this whole list I've made with circles of support and new LCSWs that we don't have on file here. Right. Yet. Here you go. So I think doulas really
do have that impact,
especially if just like Joy coming into this from a doula background, and she's already in the doula community here. It's nice to be able to pass that name along. Yeah. And I mean, you guys bringing that up is a whole other layer of the change that needs to happen. Yes. One of the things they were exploring at the conference was just the fact that, one, we're not it's not a normal screening during pregnancy for women, and that it should happen every trimester, in each trimester.
And is it becoming more normal to do it in the 6-week checkup? Is that what they're pushing, or
for the postpartum?
For the postpartum.
Yes,
but
that's
at the same
not
time,
always. It doesn't always happen.
Right.
Because, I mean, call me cynical, but the way it was presented was, if they screen for it and something pops up, they're now liable to find treatment to address for that woman.
And is the screening, are you talking about the Edinburgh, or what exactly are you talking about with which screening, and are there different screenings across the country?
There are different screenings. The Edinburgh is used most often. It's research validated. It's a good screening for what it's used for, but it's not covering everything. Right.
But what I hear you saying, even if they do, there's more of a push towards it in the postpartum. Mm-hmm. You're feeling what I heard you say, correct me if I'm wrong, that you feel like it should be being addressed in every trimester, not just waiting till the postpartum period.
Yes.
Yeah.
Well, and what they advocate for now is that it should be at the very first appointment when the woman comes in seeking care, because then if she's not already displaying symptoms, you're getting a good understanding of her baseline.
Yeah, like you do with the baby's heartbeat, with their weight, with all the other assessments that they do. That should be another assessment. It makes total sense. But that's the difference between mental health and physical health.
Yeah. And it's also putting it on the woman's radar.
Yeah.
That this is something that may happen.
Absolutely.
Because she has a good chance of experiencing some of that.
I think that's such a key factor, Joy, and this goes with so many things, like when we ask a question about people's, fears or concerns. I have always felt just by asking the question, I've helped relieve some of their worries and concerns by that means if I'm asking the question, they're not so outside the norm if they're experiencing
it.
It's validating. Thank you. That's exactly the word. And then, like you said, if they're not experiencing it, but they start to, they know it's something that they can then discuss. The door is open.
Yes.
Whether they need it or not, the door is open now.
Yeah, but we need providers talking about it, feeling comfortable with it, and then knowing where to send women.
And not being afraid of the liability issue. Yeah. I know a story that, just real briefly, and I think I might have brought this up one other time. This woman was in very good healthcare system. When she left the hospital, though, she was starting to experience some anxiety disorder issues. And when she got home, it escalated. And her husband called back to the providers to say, look, this is what's going on. And they said, she's been discharged. She's no longer our patient. And they went through hell, because then they had to enter into the mental health system, which, as you know better than anyone, it can be a nightmare.
Yes. And
it was all, when it came back to, it wasn't that they didn't care about that woman. They were afraid that they had discharged her, and now she's having this problem. Did we miss something? Will we be held accountable for this? It was a horrible experience. It added to the trauma for the husband. Yeah. That he couldn't reach out and get the care that he thought they deserved to have.
Of course.
Yeah.
That makes sense. I mean, there's now also a push to have pediatricians screening moms, because they're seeing her much more often than her care provider. Right. But the pediatricians are pushing back that she's not our patient.
Yeah.
But
they're the ones who see them.
And how the father is doing is greatly impacting the health of that baby.
Yeah. Absolutely. So where do you want to begin? And we already began. Yeah. But let's, when we talked about you talking, it was kind of like, start, Joy. So begin, Joy.
Okay. Well, how about we start with what perinatal postpartum mood anxiety disorders are?
Great.
Because we often just hear it and we think depression, but it's a lot more than that. And I think there's now more awareness that anxiety can play a piece of it, but it's even bigger than that.
Right.
So under the whole umbrella, because I kind of see it as umbrella, we have a lot of different disorders. So you have depression, you have bipolar 1 and bipolar 2 disorder, which are two separate things. You have anxiety disorder, like a generalized anxiety disorder. You have panic disorder. You have obsessive compulsive disorder. You have post-traumatic stress disorder. So there is a lot.
There is.
Should we talk a little bit about each one?
Yeah, because I had questions. So go ahead.
So the depression is the one we think of the most, and it's what often is in people's heads. It's a lot. Well, here, let me start with what it's not. Postpartum depression is not the baby blues.
Right, which is something we just posted an article about this on our Facebook page about defining the difference. And so if you could just talk about that for a moment, because I think this is a real confusion for people as when does it cross over, or what is it? And because I have always said everybody has to go through an adjustment. Physically and emotionally, spiritually, after they give birth to a baby. So we expect that.
Yeah.
So what is that in comparison to the postpartum depression?
It's about the length of time and the severity. So like a baby blues is normal. Up to 60 to 80% of women are going to experience some form of baby blues. It's going to last probably up to 2 weeks or so, where there might be some crying, some just feeling like their mood is all over the place. Right now they're fine, but this afternoon they're crying. They're crying because they're so happy. They're crying because they're so overwhelmed. But it balances itself out.
Mm-hmm.
I mean, 3 days postpartum with my son, I got home from the hospital and my husband found me crying in the closet because I couldn't find the baby thermometer. And my son wasn't sick, but I'd been like, what if he gets sick? Good moms know where the baby thermometer was.
Well, and that's why I always say, that's why I always want doulas to go see, have connection, have communication with that person at day 3, because also your milk is coming in usually, and with the milk come the tears, and it's just really, it's almost a given.
Yeah.
Yes.
That there will be crying.
Right.
Yeah. So.
And how long does this baby, what did you give it, like
about 2 weeks.
2 weeks. Okay.
So if after that you're still feeling low, you're still crying, you're having trouble concentrating, your appetite is just off from what it normally is, like you're having trouble eating, like you have to force yourself to eat. If you are having trouble sleeping, which I say that with a grain of salt, everyone's like, oh my gosh, trouble sleeping. But I'm talking about your baby has gone down for a 4-hour stretch at night now, but you still can't fall asleep. Those are symptoms.
Yeah, and you should be so
depression.
Tired that you could just fall asleep standing up.
Yes.
Right.
When you're just lack of interest, things that you used to enjoy, you're not enjoying, you're feeling like you're having trouble connecting with the baby, but also just kind of in some ways caring about the baby. Can't find any energy to do any of the chores that you need to do. That's more what we're looking at when we're talking about postpartum depression.
How do you, though, like tease that out from, I'm thinking of, somebody who has multiple children and now they're at number 4 child, and it's just, it's an overwhelm. It's like, I've got this little one, I can think of myself. I've got a 2-year-old, I've got an infant, I've got a 4-year-old, I've got a 6-year-old, managing all that and postpartum depression. Like what is
the
what
is just struggling because you have 4 kids?
That you just don't want to do the chores. You just don't, it's like you're managing. You're making sure everybody is fed, however that looks. But
with a postpartum depression, you're struggling to even get that done.
Okay.
You're crying and begging your husband not to leave for work.
Okay. So you may not get it done, even if you, because I got it done, even though it was overwhelming. But if I couldn't have finished, if I thought, oh God, I got to make kids dinner, but I couldn't make the effort even to order pizza or make the food, that would have been more towards the postpartum depression.
Yeah.
Okay.
It's, excuse me, and you'll often hear women say, I've been overwhelmed before, like when they've had multiple children. I've felt bad in postpartum, but this is different. Okay.
Yeah.
This is just, I feel hopeless. I feel helpless. I feel, and there's a lot of guilt and shame that you'll hear sort of in the language. I should be able to do this. I should. Oh, I hate the shoulds.
I know.
We all live under so many shoulds.
Well, and I said we shouldn't should on ourselves.
Yeah.
Exactly.
Yeah.
Yeah.
I call them pernicious little mother effers
in
therapy.
Yes.
That's my name for the shoulds.
Yeah.
But yeah, so you're just, and the lack of sleep, I just say, is the big one. Like when I hear a mom that's just not sleeping, and it's not because her baby is up all night nursing or crying, that's when I'm like, ooh. And I mean, there's usually going to at some point be some suicidal thoughts. So thinking about harming herself, or just maybe it's a passive suicidality, like I really wish I wasn't here. Like if something were to happen to me, that would not be a bad thing.
Is that fairly common, that thought, in a postpartum depression?
Yeah.
Okay.
And we always need to ask about it. I think people are really scared about suicidal thoughts. Like if I bring it up, it's going to make them be suicidal.
Right.
And that's just not the case. What we know is that you have to ask. And it's so relieving to women when you bring it up, because it's like, yes, and I've been so scared to tell someone that I was having those thoughts.
But you can have postpartum depression and not have suicidal thoughts.
You can.
Passive or otherwise.
Yeah.
Okay, that has to be clear too.
Yeah. So you can have the passive, just like, I wish I could go to sleep tonight and not wake up tomorrow.
Well, I remember not postpartum. This was breakup from the love of my life. I didn't want to kill myself, but I just hoped the earth would just open up and swallow me. Like that would have been okay. So that kind of feeling is what you're saying,
like
right?
If I got into a car accident on the way home and I was the only one that died,
that'd be
like
okay.
My family was safe. That'd be great.
Okay.
What I get more worried about is when a woman is telling me that her family would be better off without her.
Mm-hmm.
That's when we start talking conversations around the hospital.
Mm-hmm.
And where I'm getting a very specific safety plan in place with the mother, and I'm also requiring her partner to come in so that we can have the safety plan with him or her, and they know.
So if you were a doula, not you right now, but if you were a doula and you were hearing this, what would a doula's recommendation be?
I would say the safety planning is outside the scope of practice.
I absolutely agree.
For a doula. But
right.
It's, if you're hearing these suicidal thoughts, it's a thank you for telling me.
Mm-hmm.
Thank you for trusting me. I bet those are really overwhelming thoughts to you right now. And I'm going to work to help you get connected with someone that can help with those.
Great. Because that is the answer that I feel really strongly is the role of a doula, not only in this circumstance, but so many others about that's where we're the conduit.
Yeah.
We're the bridge often, but we're not the fixer.
No.
So just be really keen on that. I hope doulas understand this, but not all doulas do or have been instructed in that way. So, and I think if they have a partner, the pregnant, the postpartum person, they have a husband, wife, partner, that person should be involved in this as well all through, because my experience too, Joy, with this is that people can be going through and not be going through all of these things or one or some of these things, and they can't identify it themselves.
Yes.
And it really is important that the partner or whoever is that person that is supporting them in that period of time know what the symptoms are and then what the resources are for. So that's an important part, right?
Yeah. And, we talk as doulas about part of what we're trying to do with childbirth and helping the mom find her voice, advocate for what she wants, and follow her intuition is that she needs that in parenting, right?
Right.
So when a woman admits to us that they're struggling with whether it's depression or one of the other disorders we're going to talk about, you always acknowledge her wisdom in sharing it.
Excellent. That validation.
Yeah.
Yes.
She needs the validation because we're trying to continue to set her up to be empowered in her health, because that translates to
healing.
all of her life, and her parenting, her children, her relationships.
Mm-hmm. Good.
And also normalizing that she's not the only one that's been through this. It's the same as in labor, validating and normalizing what they're going through. I think that really helps. Can you talk a little bit about the anxiety and how, because that's what I see a lot, perinatal, going into postpartum?
Yes. So beyond postpartum depression, which I should say has or perinatal depression, both have a really high what we call comorbidity, which means it co-occurs with anxiety disorders. So under the anxiety disorders, we're looking at generalized anxiety, we're looking at panic, we're looking at the OCD, and I would agree that I am seeing just as much anxiety issues in therapy than I am seeing the depression, mood issues. So I
think we live in I think in daily life we're seeing more people with anxiety issues, period.
I always ask people when they come in for it, are you American? And they say yes. And I said, well, you probably have an anxiety disorder.
And that's so interesting, because when I hosted a postpartum international symposium here a few years ago, there was somebody who was in the circle who was very befuddled by some of the conversation, because she had grown up in France and she just had a very different perspective of this whole issue. And it was because she wasn't American. I mean, that was the conclusion. It was like, yeah, we'll live here for a while.
Yeah.
And then you'll understand.
Yeah.
And then she eventually became a mother, and I think she did get a better understanding. But I like that statement.
Yeah. So with anxiety, we're looking at moms that are feeling really keyed up all the time, agitated. Once again, as the evening comes, you should be going to sleep, but instead your mind is racing. You can't get thoughts out of your head. You're seeing a lot of appetite changes. These are women that oftentimes lose weight very quickly in the postpartum period, just struggling to eat what they need, but also just they're so revved up. They are having pretty constant worry. They might be having some heart palpitations, and then that kind of starts to lead into like a panic disorder. So if you're having a panic disorder, you're having actual panic attacks, symptoms of this feeling of like you're a weight on your chest or your chest is tight.
It's horrible.
Racing heartbeat. You're getting a lot of lightheadedness. You might feel like your hands or your feet are numb or tingling.
Oh, it's terrible.
Yeah. And here's the thing, like postpartum depression, like women suffering from like a perinatal mood disorder might feel like they want to die, whereas women that have perinatal anxiety disorders feel like they are dying.
I love that. I think that makes, because
that's the fear.
Yes, I've had that. I've had those panic attacks, not in postpartum, just in life. And I really thought I was dying.
Yeah.
I mean, it was so terrifying to me. And it's all those symptoms that you described. And even if you know you're probably experiencing a panic attack, you can't really get your body to respond that way. You go into that fight or flight.
Yeah.
Yeah.
Exactly. Yeah. And I kind of sometimes describe it to women that it can feel like with the anxiety overall that you are a car that's on, but you're in park, but someone is pressing the gas pedal. And that's what it feels like on the insides. Like your sympathetic nervous system is just constantly going, and it wears you out. With the panics, a lot of women will wake up in the middle of the night in the middle of a panic attack. So that's where we're also having issues with sleep, in that panic attacks come out of nowhere, but they often tend to just affect women. Just they were asleep and suddenly they wake up and their heart is racing and they're having trouble breathing, and that can be really scary for the women, and their partners are just like waking up out of a stupor like, what is going on? Which doesn't usually help.
No. Sometimes in class when I talk about this, because I do think it's important for childbirth ed to cover postpartum as well, and the normal part of the baby blues, and going into, when to reach out for help. And I think it's important to have the partners in there too, to hear that, like, what are you looking for? So some things that I will say, and I actually got this from, I think, an old podcast with Sarah Allen Short talked about, I think it was actually the Tribecast podcast, when she came on and talked about
her experience.
And we talk about the very normal, abnormal thoughts that come out after you have a baby of, what if I leave the car seat on top of the car? Right. What if someone breaks into the house and steals the baby? What if I forget the baby and leave the baby at home alone?
Or they have done everything and they're still thinking, did I? Yeah. Did I lock that door? Did I?
Yes. And what Sarah had shared.
Was the baby breathing?
Right. What Sarah had shared, which really helps me, and I think has helped clients and students, is that stuff is normal. To have all of those thoughts can be normal. But then, and she used the example of having a fear of walking down the steps holding her baby. And when it becomes to the next level is when maybe, partner comes home and finds that mom is now sitting down on the stairs and scooting down the steps holding the baby in an effort to not fall. So the now behavior is being changed. So Is that, like, how do you feel about that?
I would agree with that. I think often during those first few weeks postpartum, kind of we talk about the baby blues, that having some of those worry thoughts are very similar. Like you go somewhere with the baby for the first time, like, what if I didn't strap them in right, or we got into a car accident? And part of that is just that you are aware more than ever for the first time in your life of how powerless you are. Right? You have this little person you love so much, and you're seeing all this stuff in the world that can hurt them.
Right.
And you're just like, oh, what if I were to drop them? Just going down the stairs, I'd sometimes take them 2 at a time. I have to be more careful, right? If, as the weeks go on, you're thinking about that all day long, you're changing your behavior, you're not going places because there's going to be germs there.
Mm-hmm.
If you are on Google researching everything about the vaccines and so scared to get the shots because what about this, and people say this about shots and it could have this in it, and you're just like constantly working yourself up. That's when we're getting more into the obsessive compulsive disorder.
So are anxiety and obsessive compulsive very closely linked?
They are closely linked. With obsessive compulsive, though, you're seeing a lot of the checking behavior. So women that are
double checking, triple checking cord.
Yes, like you're going to look on the baby every 15 minutes.
Right.
And for a few minutes, it makes you feel better.
Right.
Baby's alive. But within 15 minutes, you're back to worrying and panicking. What if something's happened? You have to check the locks. You're really worried about germs. You're hypervigilant about baby's health and your health. Like, oh, what is this pain in my arm? Like, what if something's I should probably go to the doctor because I'm a mom now and I have to take care of this baby.
Mm-hmm. Okay.
Does that kind of make sense?
But they can happen together. They can be separate. Mm-hmm. But it sounds they're very closely linked.
Yes. With obsessive compulsive disorder, though, you're getting a lot more intrusive thoughts.
Okay.
So you're getting those thoughts of, what if I held my baby out over the balcony and dropped the baby? Like, what if so what can be really disturbing for women is that they have these thoughts of harming their baby or someone else doing something
or
to them,
harm coming to their
baby, and they feel just terrified by it or just like so shameful of how could I think that, right? These women are so scared that they're going to be like an Andrea Yates. Right. But women with perinatal OCD do not harm their babies. They're so terrified of it. They're usually like
super protective.
Like they might even like tell their husband, like, I can't do that for the baby. Like they might hide all the knives in the house because they've had this thought of like, what if I just picked up a knife and accidentally like cut my baby? You're not going to hurt your baby, ladies, but go get help.
Right, exactly.
We don't want you feeling like that.
What about you were saying polar, did you say bipolar or you just said, okay.
So I said bipolar 1 and bipolar 2.
2, right.
Yes. So they are very different from each other in certain ways. So bipolar 1 is you're having periods of mania. And so a good predictor, this is where we're asking women, I think as doulas, we can ask them about their mental health history.
Yeah, I think that's important.
Because it's going to affect their pregnancy, their birth, their postpartum. And what we know now is that if a woman has told you that she has had a bipolar diagnosis, I think as doulas it's safe to say I would really encourage you to reach out and not just get connected with a therapist, but get connected with a psychiatrist.
If they've been diagnosed with bipolar, though, aren't they probably, they had to get that diagnosis.
Yeah. So
hopefully they could be medicated.
They could be. Yeah.
And we would want, a doula would then want just to be, they can't be responsible, but like the conversation could be, are you in contact with your therapist, probably a psychiatrist, whoever is prescribing, just because this is important during the pregnancy? Do they know that you're pregnant and watching out for you? Does your care provider know that this is in your history?
Yes. And that is so important because there's just a lack of knowledge in some ways on the part of people, like care providers, on these medications.
Right.
And so for a woman with a bipolar 1 diagnosis, there's going to have to be some really big conversations around medication during the pregnancy and in the postpartum period, and weighing the risks of having those medications while she's pregnant, but also weighing the very big risks of her not having it.
Right.
Because when women come off their medications and they have a bipolar diagnosis, there are very high relapse rates.
So let's talk about that in, when we're a little bit further down.
So mania is more, you're having these periods of like euphoria, agitation. You have a decreased need for sleep. So like a postpartum mom that's just like, no, I'm good on 3 hours. Really? You're good on, no. They're having the racing thoughts. They're having increased productivity. So like if suddenly she has like an 8-week-old and she's baking things for a bake sale and she started an Etsy shop for this, and the house is spotless and she's cooking dinner every night for like the past week, I'd be kind of wondering
what's going on.
And that's what society tells women that they have
I know,
to be
this
doing.
as you're saying that, I'm thinking of people who I know who have done that, but I honestly can say they were not experiencing any kind of mood disorder. It was a societal disorder. It was, I am, what do they call? I am woman, hear me roar. That, which is, I will say it very clearly. It's bullshit.
Yeah. Well, and I think that's part of what doulas is within their scope of practice, is to talk around the myths of motherhood. And just this idea of the do-it-all mother and the superhero mom. And I mean, so much of my time in therapy with women is spent talking about what they see on Facebook or Instagram. Yeah. And I always just say, you're comparing your insides to other people's outsides.
Right. Or we just said in our introduction that Melanie, what she looked like she was doing on her vacation looked like it was all just, she was smiling and wonderful and, great posts and everything. But yeah, we don't know the daily minutia and the minute to minute what she was going through. I know it's, yes.
But it puts so much pressure on women.
So bipolar 1.
Bipolar 1 is having the manic episodes. Okay. And this one is very important because oftentimes they will also have the depressive episodes, and they don't seek help until they're having the depressive episode, and they get misdiagnosed as having a mood disorder on the depressive end. And if they get prescribed
the wrong medication,
it will shoot them way back up into a manic phase. Whereas bipolar 2, we kind of call it the imposter for postpartum depression, because the women are more having what we call hypomanic episodes. So they're not full on manic, but they're feeling a lot better. They're getting a lot done, increased productivity, that sort of thing again.
And this is in the first weeks? Okay.
Yeah. So they are having mood swings, whereas like a manic episode for the bipolar 1 is going to last like a week, maybe even more. A hypomanic woman and a bipolar 2 disorder is going to she's just going to have the mood swings. Like one day she's feeling this way, the next day she's feeling down. I'm good, I'm down, I'm good, and
well, how do you decipher that from baby blues?
Well, we're looking beyond those first 3 weeks.
Okay, so we're saying the 4th, 5th, 6th on weeks. Okay.
And honestly, any of these things can come on at any point.
Right. I've known people who go
the postpartum year
instantly, though, into.
Yeah.
I mean, and then, yes, others who it's 6 months out.
Yeah. These are also women that are just having, once again, the racing thoughts, a lot of hostility towards other people. They're really irritable.
Yeah, I want to talk about the anger aspect that isn't often addressed, I think, also.
Yeah, like just rages.
Yeah,
the rages.
I wondered, I'm being very transparent here, I wondered about that with myself in hindsight, not knowing, because sometimes, but I always attributed it to overwhelm, which it probably was more than anything. Yeah. But I've examined that in hindsight and wondered, was some of my just intense anger and rage was symptomatic of something more than just overwhelm? Yeah. I survived. So did my children. But yeah, it's something I don't think people are aware of, that is also, we think of depressed. But I like that you're bringing up, you can be super productive.
Well, I'm sitting here and is 6 years postpartum enough to self-diagnose every single one of these?
Also true. In grad school, when we take the class on the DSM and diagnosis, their first day, they always say, you're going to think you have everything we talk about.
That's right. Okay, so bipolar 2.
the other part of that
Yeah.
one that I think is good to know is you're seeing hypersomnia. So these are women like sleeping a lot and a
Okay.
lot of overeating.
Okay. So
Okay.
that's interesting. So the opposite of some of the other categories that you've described,
Yeah.
overeating and sleeping a lot
Yeah.
is a potential risk factor.
And that's a part of the bipolar too? Okay.
So, and I should say also too, part of the bipolar one that I didn't mention is that you are often with those long manic episodes starting to see some psychotic symptoms. So some delusions, some hallucinations. And so those women are at a higher risk for developing a postpartum psychosis.
Okay. And I don't want to go into the medications right at this moment, but can I clarify something? If you are working with somebody, if you're a listener and you are this person who has had a diagnosis of bipolar, that they've had a diagnosis of bipolar and are medicated, can they, if they're being watched well, will they have these symptoms? I'm trying to figure out, like, and maybe I'm not. Can you just suddenly develop bipolar symptoms in your pregnancy? Are you saying this is something that somebody could have without ever having had that diagnosis?
Like, could they develop it
Yeah.
during that time?
Yeah.
I mean, I'm of the belief that we can. That's just genetics, environmental stuff, all of, life stage.
Right.
And if you have other risk factors weighing heavily on you at that time, could lead to you developing something.
Okay.
More often when we're talking around a bipolar diagnosis for either one of them, there is going to be a family history. There's going to be a family history.
And if not a family history, so they could not have had the symptoms themselves, but they have a family history of it.
So they're going to know they're at higher risk.
They're at higher risk. So this is something important also for doulas, other healthcare providers to know, do you have a family history of any of these perinatal mood disorders?
Yeah.
And bipolar, for instance. Okay. But if you already were diagnosed with bipolar, I would assume the recommendation is good health and mental care being given simultaneously, and those who know how to prescribe the right drugs during that time be maintained so that there is less likelihood of these episodic issues to come up.
Yes.
Okay.
We want these women to be surrounded by support.
Right.
And their care providers to be following them closely. So these women to be seeing their psychiatrist throughout their pregnancy, to already have appointments scheduled for the postpartum period, to maybe have already gotten connected with a therapist if they weren't before. I mean, I think every woman should have a postpartum doula, but I think these women should.
Right.
Because sleep hygiene is very important for these women.
Okay. Okay, good. So those are the classifications primarily.
Yes, you also have like the PTSD.
Yeah, so talk about that. I forgot.
So that could be from a post-traumatic stress disorder, could be coming from the childbirth experience itself or something that happened during the pregnancy. These are women that are having oftentimes intrusive memories of the traumatic event. And when I say the traumatic event, trauma is in the eye of the beholder.
Thank you for saying that.
What is traumatic to me may not be traumatic to Thérèse or Melanie or someone else. And so when a woman, as doulas, when we're processing the birth, we have to respect that what to our client might have felt traumatic. We might have thought it was this beautiful birth, but they were just like, what just happened? That really freaked me out. I
think it's so important.
And so, I mean, there was a training here in Richmond about 2 years ago on PTSD around childbirth. And, it had great information, but they just talked about how these women need support. They need validation because they're struggling not just with the intrusive memories, but they're experiencing a lot of hypervigilance. Being back at the place where the traumatic event happened can be very triggering. So, like, you'll see women that can't go near the hospital where they gave birth. or just, their kid is sick and needing to go to the ER. They're like, not that hospital.
Right.
Right.
Right. And then there's people who come in already with PTSD, like from sexual assault or other life experiences that then can be further triggered into a new experience as well with childbirth.
Yeah. So, I mean, we live in a country where so many women are sexually assaulted.
Yeah, when you were saying 1 out of 5. What was your statistic at the beginning? 1 in 5.
Will experience.
And sexual abuse, the guesstimate is 1 out of every 3 to 5 will have experienced sexual abuse in their history at one time or another.
Yeah.
So very closely related.
Mm-hmm.
What about the person whose life, because my life was very stressful for so many reasons, and then adding more and more children to it just increased that stress. But
you didn't love every moment?
Yeah.
And cherish every
Yes,
minute?
and thank God we didn't have Facebook back in those days, right? But how can I say this? I had a roof over my head. I lived in a safe neighborhood. Yeah. I did have support when I actually felt like if I wanted to reach out, I could have support. My life wasn't in danger, in essence. There are so many other people who do not live those lives. Yeah. And they come in, the stress level is just their life that they're bringing into their pregnancy. Mm-hmm. I would imagine, and resources can be very limited if they are financially disadvantaged. Yeah. And if they are people of color, they can be treated very differently as well. If they're young, they can be treated very differently. Yeah. So how does this all work in?
Well, I'm really glad you mentioned that, because the way I've been talking about it thus far is sort of from the privileged perspective.
That's what because I'm feeling that. Yeah. As I'm listening, I'm thinking, and I remember, to be honest, our training that we did do here that we sponsored, that was an issue, was the resources are for those who can afford those resources. What about the people who don't have access or aren't treated well or don't have a clue?
Well, and the stressors are just totally different.
Well, they're totally different.
So what we know, when I say 1 in 5 women are usually found to have depressive or anxiety symptoms in their pregnancy and then also into the postpartum, that is just that was coming from a study of like 10,000 women. Mm-hmm. When we look specifically at teen mothers, the rates go up more to 50 to 60%.
Wow. No surprise.
A perinatal mood or anxiety disorder. God. When we look at people in a lower socioeconomic status living in poverty, once again, we're going up to the 50, 60%. And when we look at groups of people that just are struggling or are facing other forms of like racism, the amount, it just shoots up.
Well, I know
women that are going to suffer.
We had the whole discussion with Jenny Josephs in Florida, which I would recommend people listen to again, always. And this was part of the conversation, was the everyday stress that is present.
Yeah. Because there are so many mothers in this country wondering how they're going to feed their children.
Absolutely.
Let alone themselves.
And will they have a roof over their head? And
And so then they're staying in abusive relationships, which furthers the risk for having these. It just becomes like this hamster wheel. Right. Where it's like everything feeds into itself.
So much more important, again, more important, for this kind of information and support to be offered to everyone. Yeah. Not just the privileged who can have it. Yeah. So that's the big conversation.
Yes. Well, and we can talk more another time about how we try to make these resources available to more people, because that is a big problem in this country, of having access to mental health care that you're going to be able to afford.
Right.
That's going to be helpful to you. we're just struggling.
So go ahead.
Well, have we gotten through every category?
Yeah, that's what I want to. Yeah.
The perinatal mood disorders. So, and I know we didn't really touch. I mean, we touched on the postpartum psychosis, but is there, I think you talked about having suicidal thoughts is related more to postpartum depression. But when do you know that that person has gone over into the postpartum psychosis?
So psychosis is what everyone gets scared about, right? Because that's what we see in the news. I will say it's such a much lower amount of women that are suffering from this. So we're saying about 1 to 2% of women per 1,000 mothers that are going to experience something like this. So this is once again the delusions. So they're believing something really false about their baby. My baby is possessed by a demon and it's gonna hurt us and I have to save my family from this baby. Or hallucinations. So they're seeing things that aren't there. They're hearing things like their mother that has been dead for many years is talking to them about this baby. Or they're looking at the baby but they don't see the baby's face. It looks like someone else that they know. Like, why is my ex-boyfriend Joe looking up at me while I'm nursing? That would be an example of hallucination. They're having a lot of insomnia, confusion, and disorientation. Once again, kind of the rapid mood swings, and there's a lot of paranoia. So they're just really suspicious of everyone, including often their partners. This is a woman that's going to need to go to the hospital if you're seeing symptoms like this. So as a doula, if you're going to do that 6-week follow-up or even the 3-day, follow-up with the woman and she's presenting some of these issues, if the partner's not already there, it's let's get the partner on the phone. Okay. All right, partner, this is what I'm seeing. I think, I always encourage doulas. I don't think it's beyond your scope of practice to always have the number for the mental health crisis lines plugged into your phone and say, let's call this crisis number and figure out how we can get you some help.
That's good. That's good. And so, but the psychosis, it exists.
It does.
We want to put in perspective, though, it's sensationalized in the news because those are the ones we hear about.
Yeah.
And the rest of them are happening, but we don't hear about them on the news because nobody gets necessarily harmed in that horrific way. Yeah. But somebody could be experiencing some of these symptoms, some of these other categories. Could it morph into psychosis? Or is it like a...
It can. I mean, and one of the big things associated with that is the lack of sleep.
Okay.
Almost anyone can become psychotic if they haven't had enough sleep. I mean, just to be honest. Right. So this is why we pay attention to sleep and support moms and getting rest. Right. Because they need it.
And again, though, we live in a country where at 2 weeks, the majority of those who have birthed have to be back at their jobs. Yeah. So how can we even, that's the bigger issue again, but this is such an important conversation that we're having about. So it could lead into psychosis, but psychosis is less likely to occur, period.
Yes.
Okay. All of this, what it says is, there is so much to be aware of. Yeah. There is so much to be thoughtful about. And this communication and why you know this, Joy, as a counselor, but you know this as a doula, how important this communication aspect is, that it's so much more than the healthy baby, healthy mother thing, which only looks at physicality, I feel, not anything else, but they're alive. And that's, they're alive and they can function physically. This is the bigger conversation. It's the whole. It's the whole. And what I'd like to do, and you lead us in this, because you might have more to contribute right now, but what I'd like to do is actually pause and let our listeners have time to really absorb what has been said. And we're going to have resources listed also for all of you on our website about some of these things that Joy has been talking about. But I'd like to do a second part with you
Sure.
and carry forward with all more that you have to say about help, resources, and so forth and so on.
Treatment options.
Yeah,
whatnot.
treatment options, all of that. That would be great. Does that work
I'd
for
love
you?
to. Yeah.
Okay.
Yeah, we'd love for you to come back.
Yeah. So, my head is, these are things that I've heard. These are things I've actually experienced with clients. I mean, I thankfully only had one person, and it was in sometime in the first decade of my doing work, and I was working with a really good healthcare provider where the woman was going into psychosis. And the hard part, I will tell you, was to reel her in was incredibly difficult, and had full support of the husband, who was terrified of what was going on. But then what made this so much worse was the mental health situation of finding her a place to go. She ended up having to go be admitted in a hospital that was like an hour and a half, 2 hours away from her family, because nobody would take her. I mean, there weren't beds available, and that just added to more trauma for the family because of the separation. And I will tell you who needed so much help. She got help, and she recovered, and she was medicated, and she came back into her life. She had really no memory of what had transpired. Her husband had to get therapy. I mean, that was the recommendation that we gave him.
Yeah.
He was so traumatized because he couldn't forget it.
Mm-hmm.
He watched this person he loved become this person that was terrifying to him, terrifying that she would hurt their baby and their other children. I mean, it was a terrible situation, and fortunately he did get help. But that's another aspect of this, is what the partner goes through as well.
Yes.
And
certainly.
it was scary. I remember thinking, this is like a nightmare. Like, it made me, even remembering it makes me feel shaky inside, because it was really scary.
Yeah.
But only once have I had that experience professionally, fortunately.
Yeah.
But many of the other ones.
But I think that speaks to how rare
Yes.
the postpartum psychosis
Yes.
is.
But not rare. And I will just say, and then we will stop here. I have actually, you could say it's awareness, but I don't think it's awareness. I think that plays into it. Because I've been doing this work for so long, I've seen a real increase in these symptoms in women, in their families, in the last decade, more than I did in the first decade plus. It just, I know it's awareness. We're able to speak about it more. I know there's more information out there, but I just think it's the state of our culture, our world, and how we've changed physically.
Yeah. Well, awareness can be a cop-out if you're not doing anything once you are aware.
Right. That's true.
And my husband, the wonderful man he is, will go on a soapbox at any moment about how we give motherhood all this lip service, but we do almost nothing in our culture to support women and mothers.
It's so painful.
Yeah.
Because one thing, when we did this, when I was head of another organization, we did the maternal mortality task force big symposium. It was awesome. What was the most significant thing he said there is, everybody was born. Mm-hmm. We were all born.
Yeah.
And we all came through a woman at one time, a person at one time. And so this affects every single person on this planet.
Yeah.
So if this isn't the issue you want to pay attention to, I don't know what you want to pay attention to. So, well, Joy, what we'd love to do is have you come back and talk to us about the rest of this, because I just think it's such a huge topic, and we just are at the very tip of it. So thanks, everyone, for listening.
Thanks, everybody, and stay tuned for our tip.
And we will do part 2, hopefully the next episode.
Perfect.
Thanks, everyone. So that was really great.
I learned so much.
I know. It's reminding us I think, all of us listening about the importance of knowledge and not being afraid to understand, and understanding that you don't have to understand everything because that's not your job, but having an awareness and then the communication aspect. But what I liked what Joy brought up was the importance. I mean, this to me is one of my big takeaways from the listening, is how this has to be addressed in the pregnancy. This is in the first trimester, the second trimester, the third trimester,
Yes.
that we don't wait just till the baby has been born. And that, to me, why it's my takeaway is I feel like, duh, I know that, but the focus has been so much about identifying it in the postpartum, which obviously is still as important, but it can be beginning, it could be there in the pregnancy.
And giving the woman responsibility for her own health as well. And
Right.
so that she can keep tabs on her own mental health.
Right. And
I
her
love that
voice.
aspect.
And so I'm looking forward to the next episode as well, when Joy talks to us again.
Yes.
So go ahead.
And you've got a tip.
Yeah, it's a pretty simple tip. It's really about a lot of people during pregnancy nowadays are starting to hear more about like drinking a pregnancy tea, and others have no idea. And I think it's a really nice suggestion we can make to clients that, from toLabor's perspective, is not outside of scope of practice, and it's something that they can absolutely talk to their care provider about, and know that, you know, what is being offered is safe, quote unquote. But you can look. There are different websites, different companies that sell a pregnancy tea mixture. There might be people in your own community, I know here in Richmond, where they formulate teas for pregnancy and sell them. There's a coffee too, the big tea place here in Richmond that, you know, actually has a pregnancy tea that you can buy.
Carytown Coffee and Tea.
So it is coffee too. I gave up coffee when I finally went in there, so I wasn't focusing in on coffee. But one of the ones that you want to really consider making sure that they have in there is nettles. And, you know, you could just recommend that nettles tea be something that they drink. It's high in vitamin K, and it's a great thirst quencher, and it has iron and important other antioxidants. And they can mix it, though, with other herbs such as oat straw, red raspberry leaf tea, red clover. These help with supporting the blood volume and toning the uterus. And it's wonderful and refreshing, hot or cold. And if they drink it during their pregnancy, it will not harm. It can only enhance. The red raspberry leaf tea can be, I remember drinking that throughout I think it was starting in my third pregnancy, and I would drink it. I was always pregnant in the summer, so I was drinking it as an iced tea, and I would add it to like lemonade, and it was really
put some mint in there.
Yeah, it was such a great thing, and I feel like it really supported my uterus for less prodromal. I mean, and I did that with each pregnancy that followed, and I just felt like my contractions, when they came, were more organized. And there's no guarantee that that's what it was. There's no guarantee that what it will do, but it is a uterine toner. It's like strengthening our other muscles. And if you drink it during pregnancy, they can also take it and drink it during their labor, because it provides all of those same nutrients, and it's good for blood clotting, vitamin K for the mother and the baby. And they can continue to drink it in the postpartum, because it is still supporting all of those important aspects of pregnancy.
That's great.
Yeah. So nettles, red raspberry leaf, oat straw, red clover, those are just some of them. They can add in other things as well, but it's a really nice suggestion.
Did the one that I drank have alfalfa in it?
Probably, because that's a really good one for vitamin K and iron as well. So somebody can do more research into this, but it's something that is nice for people also. It's like their special drink. It's something that they remember for their pregnancy, and it's something they carry into their labor with them. And then there are teas. That'll be another tip for breastfeeding. That's also great. To really support the postpartum. So that's my tip.
Thank you, Trace. Thanks for listening, everybody.